This review is going to focus on pharmacology, drugs, and sports, Chapter 17 of your McGraw-Hill Prentice text. In general, exercise will decrease the drug's absorption after oral administration, whereas exercise increases absorption after intramuscular or subcutaneous administration because of an increased blood flow in the muscle. Thus, exercise has an influence on the amount of a drug that reaches a receptor site, which significantly will affect the activity of the drug. In this review, we will talk about the basics as it relates to pharmacology, drugs, and sports so that you understand the various types of drugs commonly used by athletic trainers and, if any, of their associated side effects. Pharmacokinetics, pharmacodynamics, and half-life. Pharmacokinetics is the method by which drugs are absorbed, distributed, metabolized, and eliminated or excreted by the body. Pharmacodynamics is often confused with pharmacokinetics. Pharmacodynamics refers to actions or effects of a drug on the body, but not the method of which they are absorbed, distributed, metabolized, or eliminated. Half-life is the rate at which a drug disappears from the body through metabolism, excretion, or a combination of the two. This rate is the amount of time required for the plasma drug level to reduce by 1/2. For most drugs, the half-life is measured in hours, but for some it's measured in minutes or days. Knowing the half-life of a drug is critical in determining how often and in what dosage a drug must be administered to achieve or maintain optimal therapeutic levels of concentration. The athletic trainer's role in dispensing drugs. There are two types of drugs, prescription and non-prescription medications. Prescription medication at no time can anyone other than a person licensed by law legally prescribe or dispense prescription drugs for an individual. An athletic trainer, unless specifically allowed by state licensure, is not permitted to dispense a prescription drug. Non-prescription medication. Non-prescription medication or non-prescription drugs, the situation is not as clear-cut. In general, what you should know is that the athletic trainer may be allowed to administer a single dose of a non-prescription medication. For example, most secondary schools do not allow the athletic trainer to administer non-prescription over-the-counter drugs that the individual is to take internally, including aspirin and over-the-counter cold remedies. However, some secondary schools allow application of non-prescription wound medications under the category of first aid. On the other hand, some secondary school athletic trainers in the United States are not allowed to even apply a wound medication in the name of first aid, but can only clean the wound with soap and water. The patient then must be sent to the school nurse. It's important for you to understand that different laws pertain in different states. At the college or professional level, minors are not usually involved, so the administration of non-prescription medications are less restrictive. It's assumed that patients who are of legal age have the right to use whatever non-prescription drugs they choose. However, the right does not preclude the fact of the athletic trainer must be reasonable and prudent about the types of non-prescription drugs offered to individuals. There are a variety of drugs used to reduce pain. Some of these include counter-irritants. Counter-irritants is things such as mineral ice, icy hot, spray coolants, alcohol, codeine, morphine, and acetaminophen. Acetaminophen is the more commonly used drug to reduce pain. Acetaminophen is also known as Tylenol. It's an effective analgesic, anti-pain, and antipyretic, anti-fever reducing, but has no anti-inflammatory activity. Because it doesn't really irritate the GI system as much, it is often the replacement for aspirin in non-inflammatory conditions. Drugs to reduce inflammation include aspirin, NSAIDs, and corticosteroids. Aspirin is one of the most widely used analgesic, anti-inflammatories, and antipyretics. A problem that can arise in individuals under 18 years of age is Reye's syndrome. Reye's syndrome is a fatty infiltration of the liver, kidneys, and heart because of the ingestion of aspirin. Common generic form of aspirin is known as Bayer. NSAIDs are non-steroidal anti-inflammatory drugs. Examples of NSAIDs include Motrin, ibuprofen, naproxen, Aleve, Celebrex, to name a few. NSAIDs have anti-inflammatory, antipyretic, and analgesic properties. Though the capabilities are equal to those of aspirin, their advantages are fewer side effects with irritation of the GI system and relatively longer duration of action. Corticosteroids, of which cortisone is the most common, are primarily used for chronic inflammation of musculoskeletal and joint regions. Cortisone is a synthetic glucocorticoid that is usually given orally or by injection. These drugs predispose people to heat-related problems. Each of them affect heat illness differently. The first group are vasoconstrictors that predispose an athlete to heat illness. The next group decrease the peripheral mechanism of sweating and therefore eliminate the body's ability to lose heat from this mechanism. Diuretics prevent volume expansion and limit cutaneous vasodilation. This page in your apprentice text talks about protocols for the use of over-the-counter drugs for athletic trainers. You should familiarize yourself with these protocols. Ergogenic aids is a term used to describe any method, legal or illegal, used to enhance athletic performance. Athletic trainers should have a primary concern about the use of various pharmacological agents for enhancing performance. Stimulants are used to increase alertness, reduce fatigue, increase competitiveness, and even hostility. Some individuals respond to stimulants with a loss of judgment that may lead to personal injury or injury to others. There are a variety of stimulants you should be familiar with. We are going to discuss several of them. However, you should refer to page 482 in your apprentice text to learn about or review the others. Many athletes believe amphetamines improve performance by promoting quickness and endurance, delaying fatigue, and increasing confidence. However, studies have shown that there's no improvement in performance, but there is an increase in risk of injury, exhaustion, and circulatory collapse. Like amphetamines, caffeine can sometimes affect athletes by acting as an ergogenic aid during prolonged exercise. The United States Olympic Committee considers caffeine a stimulant if the concentration in the athlete's urine exceeds 12 milligrams per milliliter. The other ones that you should review include anabolic steroids, as well as knowing basic signs and symptoms of steroid abuse, THG, andro, HGH, human growth hormone, and blood doping. Drug testing in athletes. The USDA is an independent group who provides oversight for drug testing programs. The USADA indicates that there are random drug testing done throughout the year for all athletes prior to a United States Olympic Committee sanctioned competition. So anyone who's completing an Olympic Committee sanctioned competition must be drug tested prior to competition. The NCAA has mandatory random drug testing in specific sports during the year and after NCAA championship events. Again, it's all randomized. The National Federation of High Schools does not currently have a list of banned substances or policies, and drug testing is left up to the individual states. A drug test. So in order for an athlete to have a drug test, there are two samples given, an A and a B sample. Direct observation of the athlete urinating into two separate sample specimen bottles occurs during a drug test. If the A bottle is tested positive, the B bottle is then used to confirm the positive test. This chart in your text talks about banned drugs. Drugs that are banned by both the NCAA and the United States Olympic Committee include drugs banned by the USADA only include narcotics and corticosteroids. Drugs banned by the NCAA include local anesthetics. And dietary supplements are not banned by both, but both groups recommend using it at your own risk to understand what is in the supplement that could possibly cause the supplement to be banned. The USADA, or the U.S. Anti-Doping Agency, allows for medications to be taken for individuals who need them for medical purposes. Individuals who need to take banned substances for medical purposes must complete a respective form. This concludes this review.